I'm here to check your blood sugar and give you some insulin. Can I get your name and date of birth, please? Okay, verify against the armband. Alright, first I'm going to come in here. I'm going to turn on my AccuCheck machine. I already have my alcohol swab, my gauze, my gloves. I went ahead and brought the insulin and the needle in here. Alright, first I'm going to put on some hand hygiene. I'm going to put me on some gloves. And I'm going to take an alcohol swab, wipe my patient's finger, wipe off the excess alcohol, prick the patient's finger, and put the blood on there. Looks like he has a 252 blood sugar testing reading. Alright, now I'm going to mix up your insulin, okay? Alright, I'm going to take my gloves off, throw away the strip, clean my meter off, throw away the sharps, the prick in the sharps container, throw away the alcohol swab, throw away the gauze. The patient is bleeding, obviously give him the gauze back. The gauze to put over it. Alright, now I'm going to perform my hand hygiene and go to my computer. I'm going to go to my computer, I'm going to put in the blood sugar, look at the patient's sliding scale. He's going to get 6 units of regular insulin and 16 units of NPH. So what I'm going to do is I'm going to call a second nurse to come in to verify the amount of insulin I have before I administer. As I'm waiting on the nurse to come, I'm going to go ahead and mix my insulin. Since I'm going to be doing it in the patient's room, I don't have to label the syringe. However, if I did, I would label the syringe. Alright, I'm going to slightly mix up my NPH. And I'm going to take out my syringe. I'm going to put 16 units of air in here. First, as I'm going to insert the air into the NPH vial first. Then I'm going to draw up 6 units of air to put into the regular vial. Once I insert the air, I'm going to go ahead and pull out my 6 units. I'm then going to pull up 16 units of NPH, which goes to a total of 22 units. Making sure there's no air bubbles as I do this. Okay. Now my nurse has walked in and she has verified that this is 22 units of insulin. For today's purposes, I'm going to be using this football. Alright, still in the patient's room. Put on hand hygiene. Don my clean, new pair of clean gloves. Alright, I'm going to clean the site with alcohol. The sites we will use subcutaneously, back of the arm, abdomen, thigh, rotating injection sites. Okay, I'm going to insert at a 90-degree angle, 45 degrees if the patient is thin. Insert my insulin. Place the alcohol swab over. I'm going to discard of the needle into the sharps container. Take off gloves. Throw away everything. And hand hygiene and document in the computer how much insulin and of each that I gave. So now we're going to talk about signs of hypoglycemia, and that's when you have low blood sugar less than 70. Your patient will be cold and clammy. He'll be having blurred vision changes. You can go into a coma, headache, and fatigue. Hyperglycemia, you can notice a fruity breath smell, and they'll be hot and dry skin. Alright, and that concludes my video.